Welcome to how to get started using the CO₂ with the Servo-u Ventilator. We'll walk through the CO₂ analyzer calibration process. Insert the CO₂ module and connect the CO₂ cable. When the CO₂ module is inserted, the symbol becomes visible on the screen. We will now go through how to calibrate the sensor during ventilation. The CO₂ sensor must be calibrated using an airway adapter. There are two adapters available. The white adapter is for the adult patients and the red adapter is for the infant neonatal patients. If calibration is necessary, a message will appear on the screen. If calibration of the CO₂ sensor is not performed and the CO₂ sensor is connected to a patient circuit, the CO₂ waveform is displayed, but no measured values will be displayed. Until calibration is complete, the waveform will have reduced accuracy and no CO₂ value will be displayed. I will now show how to calibrate the sensor. Each step of the calibration is displayed before beginning the calibration procedure. The sensor needs to be worn. This is done automatically. Note this can take a few minutes. Final step is to connect the CO₂ adapter to the patient circuit. You can find the entitled CO₂ here. By tapping the green arrow, you access the CO₂ minute elimination and the CO₂ title elimination. Once the CO₂ sensor is calibrated, you can enable or disable CO₂ monitoring and alarms by tapping the CO₂ button. Even if CO₂ monitoring is disabled, the sensor will retain the calibration. The CO₂ values are also trended and can be found in the trend window. The entitled CO₂ alarms can be set in the alarm window. It's also possible to calibrate the CO₂ sensor in standby. Go to Calibration in the menu and follow the on-screen instructions. Thank you for watching. Check the user's manual or feel free to reach out to your local Getting representative.